But our top story tonight, with every passing day, COVID cases in the country are increasing at the very rapid rate. The latest, we're about to cross 2 lakh mark in daily cases as COVID infections continue to rise across the country. The next fortnight could be critical because the numbers, by all indications, could go even higher. Most epidemiologists, in fact, are saying that this wave could peak anytime between the 15th of January and the 15th of February. And infections in cities like Delhi and Mumbai could hit 50,000 cases per day. As this third wave peaks, how bad will it get? How prepared is India? In a moment, I'll be speaking to the World Health Organization's top official on this issue. But first, Sneha Mordani's special report.
The third wave is sweeping India. The country is seeing an exponential growth in COVID cases. India reached the 1 lakh mark in just 10 days this time. The 1 lakh figure was reached in the second wave in 50 days and 120 days in the first wave. On Monday, India reported close to 2 lakh infections. Mathematical projections indicate that this is going to rise further.
ये बहुत ज्यादा तेज फैलने वाली सुनामी जैसी लहर है। जो आंकड़े हम देख रहे हैं, ये पहले आंकड़े कभी नहीं देखे। टेस्टिंग संख्या और टेस्टिंग लैब्स के ऊपर भी उसका थोड़ा स्ट्रेस हो गया है। तो टेस्टिंग लैब और इंफ्रास्ट्रक्चर पे स्ट्रेस जरूर हुआ है, लेकिन उसकी जो तीव्रता है, जैसे आपने सही बताया, वो बहुत कम है और अस्पतालों में अभी अगले 2-3 हफ्ते में हमको पता चलेगा, बहुत ज्यादा इसका इम्पैक्ट नहीं होगा।
While experts differ on when India will peak, most agree cases will decline by the end of February.
In cities like Delhi, Mumbai, where the numbers have been rising very fast for past week or so, they will continue to rise very sharply, with the peak estimated somewhere around middle of this month. That is, in about a week, 10 days from now.
India had such a terrible Delta wave. That combined with vaccination efforts suggests that there's quite a bit of immunity in India that will provide some protection against Omicron. So what we expect to happen is lots and lots of Omicron infections, reaching a peak in the end of January or first week of February.
Doctors say it is not the caseload we should be looking at this time, but hospitalizations and ICU admissions.
What is different from the Delta wave so far has been that the number of people who require inpatient hospitalized care is substantially lower than it was for Delta.
Sources within the INSAGOG, the consortium of labs undertaking genomic sequencing in India, say that in metropolitan cities, the prevalence of Omicron is to 90 to 95%. They also say that Omicron is well on its way to replace Delta as the predominant variant in India. Well, the rate of infection is much, much more. But hospitalization and oxygen use is not alarming. Far from it is what sources indicate. In New Delhi, Sneha Mordani for India Today.